Good morning, everyone. I am Karizza Theeia Ellyze Napala, and I am from BSN 3B, and I will be making a report on a study entitled Knowledge, Attitude, and Convenience on Self-Medication Practices Among the University Students in Bangladesh, Exploration Using Structural Equation Modeling Approach. So, for the nature and scope of the study, it is a cross sectional descriptive study that investigates the factors influencing self medication practices among the university students in Bangladesh. So, this scope focuses on 417 students from five public universities in Bangladesh, representing diverse academic discipline and backgrounds. So, this research specifically examines how knowledge, attitude, and convenience influence these practices. So using the CAP or the knowledge, attitude, and practice model, which is a causal framework. It addresses the gap in understanding the factors driving your self-medication practices among the university students. So this study specifically examines how knowledge, attitude, and convenience can contribute to the practice of self-medication among students. So for the objectives of the research, we have five. The first one with to investigate the factors influencing self-medication practices among university students in Bangladesh. Next is to examine the role of knowledge about the medications and the adverse drug reactions or the ADRS in shaping your self-medication behaviors. Third one is to analyze students' attitude towards self-medication and ADRS, as well as their impact on self-medication practices. Fourth is we have to assess the influence of perceived convenience on self-medication and the inconvenience of obtaining prescribed medication on students' choices. Fifth, which is the last part, we have to develop a comprehensive causal model using a structural equation modeling or your CEM to explain the relationship between your knowledge, attitude, and convenience and the practice of self-medication. Next is we have your research method. So this research, it is a quantitative research. It is a cross-sectional descriptive design using a quantitative approach. So what is this cross-sectional study? Cross-sectional study means it is a type of research design where data are collected at a single point in a time from a specific population. Next, the sampling was done using a random walk technique. So your random walk technique, it is a sampling method where the data collectors will move in a systematic direction. For example, it will be starting from an entry point and then proceeding clockwise. So it is an approach wherein the data collectors will approach the nearest eligible respondent. So this sampling method will ensure the randomness while covering the different areas of the study site. So next is for the analysis, the researchers use descriptive statistics, one-way ANOVA, confirmatory factor analysis or your CFA, and structural equation modeling or your CEM. So what is this descriptive statistic? Your descriptive statistics, it is the basic statistical tool, which are your frequency, your mean, your percentage, and your standard deviation. So these statistics are used to summarize and describe the general characteristics of the data collected. While your one-way ANOVA or your analysis of variance, it is a statistical test used to compare the means of three or more groups to determine if there are significant differences between them. So in this study, it was used to identify the differences in self-medication among groups with varying levels of knowledge, attitude, and convenience. Next is we have your CFA or your confirmatory factor analysis. So your CFA, it is a statistical technique used to test whether your collected data fit a hypothesized measurement model. So it checks if your questionnaire items accurately measures the intended construct, for example, which is your knowledge, attitude, and convenience. Next is we have our theoretical framework. So, in this framework, we have this framework explains the different factors that influences the practice of self-medication. So, the reasons why people choose to medicate themselves instead of consulting a doctor. So, at the center, which we have here, the practice of self-medication. This is the dependent variable in the study. So this is the main behavior or the outcome that our study or the study wants to understand. So surrounding it, we have the independent variable. So these are the factors that may influence the practice. So this includes your knowledge about medication, about the adverse drug reactions, the attitude towards self-medication, and the ADRS, the convenience of self-medication, and the inconvenience of prescribed medication. So, all these factors are connected to the practice of self-medication, shown by the arrows labeled to H1 to H6, which represent the hypothesis or the relationship being tested. Next is we have the findings. So the students had intermediate knowledge of medication but only basic knowledge on ADRS. A positive attitude towards self-medication strongly increase the likelihood of practicing it. Next is the convenience of self-medication and the increased um, inconvenience of prescribed medication were major drivers of the practice. And lastly, the model explained 87% of the variance in self-medication showing among predictive power. So, in conclusion, the study found that Bangladeshi university students had intermediate knowledge on medications but very limited awareness of the adverse drug reactions or the awareness. So, their positive attitude toward the self-medication strongly encouraged the practice. So, the convenience and the difficulty of accessing the prescribed medication were the major drivers, with the model explaining 87% of the variance in self-medication behavior. So lastly, what are the implications of the findings of the study? First is we have a stricter regulation and monitoring of over-the-counter or your OTC drugs are needed to reduce unsafe and self-medication. Next is we have the universities and um, the health agencies should provide education and awareness programs focusing on the risk of self-medication and the ADRS. And the third one, we have improving accessibility and affordability of healthcare services is essential to lessen the reliance on self-medication. So the findings imply that stricter regulation of over-the-counter drug sales is very necessary to minimize the self-medication practices, as well as the educational and awareness programs should be implemented in universities to address the risk of self-medication and adverse drug reaction. Furthermore, and most important, is to improve the accessibility and the affordability of healthcare services. So, this action it is a crucial one to reduce the students' dependence on self-medication. That's all for my study. Thank you so much for listening. Have a good day. Thank you.